Good morning, lovely ladies. I'm Farah Seedat, a pediatric dentist, and I'm here today to talk about something known as non-nutritive sucking. It probably sounds like a mouthful, but if I'm any good at what I do, I'll succeed in my goal of explaining what it is and how it can literally shape your baby's future health. I saw this on social media recently and saved it to use today. Oral health, babies, and education. Three things I must admit I love. So, thank you so much to Nook for this amazing opportunity to address you all this beautiful morning. Now, I know that dentists aren't society's favorite people, but I only have you guys for a short while, and I've been told I'm not that bad. So, let's see how it goes. I'm going to dive right in. How many of us know someone that has a similar looking smile? By the way, this is Kim Cattrall. As one would get older, the smile would turn into something like this, and then like this into adulthood. Now, for some fortunate people, their quirks are celebrated and they end up becoming iconic, like Amy Lou Wood, who I'm sure we all know very well.
But for most people, this is what they would typically experience. For me, these insecurities began in primary school. Standing out for the wrong reasons is never fun. Oh, sorry. Sure. Whenever a tooth related insult came my way, I'd get upset, cry to my parents, and beg them to get me new teeth. Teasing over teeth in primary school can leave lasting dents in a child's self esteem. And the thing is that these comments stay with the child for a very long time and actually affect how they see themselves at that very critical formative age. It even affects how freely they're willing to smile. And I've seen this quite often in practice. And can you believe that all of these things can be tied back to one common denominator, and that is non nutritive sucking? But a soother is something that should be helpful by comforting your baby, not by compromising their development. However, I'm here today to shed some light on a very important point that luckily not all soothers are created equally. And hopefully by the end of this, you guys will be able to see exactly why. So if you're like me who loves online shopping and is a sucker for cute packaging, then I'm sure these dummies would have caught your eye. I mean, different colors, they're silicone, they're safe to use, attached with a teddy bear, and you can buy different colors to match different outfits. I mean, like, what more could a modern mom want, right? And not forgetting these cute flower design dummies that have matching beads. I mean, it literally is like a shopper's dream. However, I would like to explore the science behind dummies and how an innocent decision, like choosing a dummy, can end up having lifelong consequences on our little ones. And that's where I come in. So, you know my name and you know what I do. I'd like to share a bit more about my philosophy on treatment. And that is, I believe in preventive care and I believe in holistic care. I treat the whole, not just the whole. And with that, I'm super excited to present to you the science of non nutritive sucking. So, what is NNS for short? It's basically when a baby sucks for comfort, not for feeding. And this actually begins while they're still in the womb. It's a natural reflex babies use to soothe themselves, fall asleep, and feel secure, even when they aren't hungry. And something as simple as sucking can have a big impact on your baby's development, from calming their nervous system to literally shaping their faces. So, a dummy is one of the tools of NNS, and it plays a huge role in growth because it directly affects the shape of the mouth, the jaw, and even the way that we breathe. People look scared now. Don't worry. Okay, let's have a look at some of the benefits of non nutritive sucking or NNS. Number one, self regulation. I mean, it's soothing, it's calming, it's comforting. A happy baby equals happier parents. Number 2, better sleep. It even can provide some pain relief, especially during things like having a vaccine or even teething. And then for premature babies or babies in the NICU, it actually helps them develop a sucking reflex, which is an important milestone for them to develop before these babies are discharged. Muscle function. So it stimulates the muscles that contribute to growth, the same muscles that control feeding and speech. And then lastly, SIDS. So SIDS refers to sudden infant death syndrome, which is one of the most devastating tragedies a parent can face. And using a dummy has been shown to reduce the risk of SIDS while the baby is asleep. I'd like to elaborate a bit more on the main purpose of NNS. So, the act of sucking triggers the release of calming hormones in the brain, helping babies feel secure and settled. It also plays a key role in emotional regulation, allowing babies to self soothe during moments of stress or discomfort. And when it's done properly, this actually encourages the mouth to stay closed, supporting healthy nose breathing. And now we know that nose breathing is essential for quite a number of things, which I'll touch on a little bit later on. However, there are also some downsides of using a dummy to soothe, which I will discuss now. So the first one, it can disrupt the way our jaws are supposed to grow. It causes our soft upper jaw to collapse and become smaller. So basically, if you're looking at someone, you want the jaw to actually be nice and wide like this. And what happens is it actually ends up collapsing in, which then gives us a narrow jaw. A very important one, it displaces the tongue and prevents it from being in its most natural position. So as you guys are right now with your mouth closed, where is your tongue? Yeah, it should basically be in a suction on your palate. If it's not, perhaps just come and talk to me after this is over, okay? It also weakens the oral and the face muscles. That includes changing the way that we swallow, which actually can contribute to fussy eating. It causes crooked teeth. It also can cause bite problems because the teeth end up not fitting together properly. It even changes the shape of the face. And lastly, less breathing space. So yeah, you heard right, less breathing space. Now, bear in mind, these are the side effects of using the incorrectly shaped dummy. So there is hope, okay? And the longer these dummies are used, the more the severe the effect. And the thing is that these side effects aren't just present in childhood. They can end up affecting someone all the way up into adulthood. And that's why it's such a big deal. I find that when dummies are used almost as a crutch or used inappropriately, this very often happens. But when you use dummies responsibly, the way it's meant to be, which is just a tool, then you would see less of this actually happening. So I have a quick 10-second activity for you guys. It's similar to what our previous speaker just had, but I would like you to just slightly pinch your nostrils closed ever so slightly and try to breathe like normal. It must close a little bit. And just take a moment to notice what that feels like. It's not as easy, right? Did you end up having to breathe through your mouth? Probably, right? So going back to the last effect I spoke about with the wrong dummy usage is that it results in less breathing space. Now, why would that be so concerning? The wrong dummy can narrow your airway, and that can cause your baby to end up breathing through his or her mouth purely because it's easier. But mouth breathing is bad. And let's take a look at why. So, amongst many reasons, number one, it dries out the mouth, increasing the risk of tooth decay and bad breath. It disrupts our natural tongue posture, leading to a narrow palate and crooked teeth. Because if you're mouth breathing, your tongue physically cannot rest on the roof of your mouth or on your palate. It's linked to poor facial growth and appearance. Have you ever heard someone being called a mouth breather? It's actually an insult, and I'll show you a picture while later on. It's linked to poor sleep, snoring, and even behavioral issues in children. It can cause tiredness, irritability, and trouble focusing throughout the day. It even increases the risk of developing speech difficulties. And most importantly, mouth breathing may reduce overall oxygen levels and may reduce brain development over time. And get this, a connection most people don't expect. Mouth breathing can affect a child in a way that's often mistaken for ADHD. So, chronic mouth breathing, meaning long-term mouth breathing, especially during or whilst asleep, will reduce the amount of oxygen that's getting into a child's brain. This leads to poor sleep quality, frequent waking, and basically a restless night of sleep. Now, mouth breathing, like we heard earlier on, is designed as a mechanism for us to breathe during a stressful period. For example, when we're being chased by a dog or something like that, or waking up from a nightmare. Now, if you're mouth breathing at night, your body thinks that it's in a panic mode, and it doesn't allow your body to actually go into a deep, rested, and relaxed mode. Now, what happens when kids don't go into a deep, sorry, one second. So, what happens when kids don't go into a deep, restful sleep? They may seem tired, distracted, or even hyperactive during the day. And this often mimics signs of ADHD. In actual fact, studies have shown that approximately 50% of children who are currently diagnosed with ADHD actually are struggling with sleep or breathing problems, not true ADHD. So, the wrong dummy can change the way that we breathe. And now you can see why this is so important. Half of these kids might not even have ADHD, they may just be breathing incorrectly. And what is proper breathing? Nature designed us to breathe through our nose, and for very good reason. Let's have a look. So, number one, it filters and cleans the air. It traps dust, allergens, and, and germs in the nasal hair and the mucus. Number two, it warms and moistens the air before it reaches the lung. That means that whatever oxygen we do breathe in is able to be absorbed into our bloodstream. It supports strong immunity. Nose breathing activates the immune responses that are in our airways. It supports optimal tongue posture because when you are nose breathing, your tongue can easily rest up against your palate. It encourages proper development of the jaw, the palate, and the airway. It also promotes and optimizes ideal facial growth. And I'll show you a little bit more on this in the next few slides. It, of course, improves sleep quality because it allows you to go into a deeper, more restful sleep. Reduces the risk of snoring and daytime tiredness, which is very important for children. And I'm sure you'll realize this once you have children of school-going age. It lowers the chance of speech issues. And lastly, it helps with focus, behavior, and learning. Lastly, releases nitric oxide, as we've heard just now. So it sounds scientific, but this actually plays a very big role in little bodies, even adult bodies, staying healthy. It helps get more oxygen into the lung, number one. It supports brain development and even helps fight off germs. It's like nature's way of giving nose breathers an extra health boost, quietly working in the background with every single breath that we take through our nose. Now, I've spoken quite a bit about palates or upper jaw. This is what a normal palate should look like. And this is what the palate looks like of someone that sucked the wrong dummy for a longer period of time. And you don't even have to be a dentist to see that these two look different, right? You can see that. So the reason why this is so important is because our palates are not isolated structures in our bodies. Our palates are the base of our nose or our airway. So if anything causes our palate to even narrow by 1 millimeter, that means that our airway also becomes smaller. And that's why I asked you guys to see what it would feel like if you pinched your nose closed a little. So what happens to the airway, instead of being nice and round and open, it actually ends up becoming narrower and almost tear-shaped, which you can see is much smaller versus being nice and open like this. So we want to avoid this at all costs. Now, let's have a look at how this will affect how you look on the outside. So the previous slide showed us what it would look like inside the mouth, and let's see what it would look like outside the mouth. Someone with a wide palate would look something like this. He'd probably breathe through his nose, have a wider face with well-defined cheekbones, and usually straight teeth. However, someone that has a narrow palate, who most likely breathes through their mouth, would look something like that. And they usually have a narrower, longer face with poorly defined cheekbones, and the teeth are usually crooked because there isn't enough space for all the teeth to fit in the mouth. And if we look at the side profile, you can definitely spot the difference, right? So, like I said, it changes the shape of your face. So, when it comes time to choose a dummy for your baby, trust me when I say it is a huge decision. I'm sure you feel slightly overwhelmed by everything I've just shared, which I'm sorry for, but I'm really on a mission to actually help kids from the very, very beginning. So you get two types of basic dummy shapes. You get these rounder ones that I'm sure we're used to seeing everywhere, and then you get these flatter ones. This is the one you want to avoid at all costs. The only type you should ever go for are these flatter dummies like the Nook one. Funny story, I was actually showing my practice manager this presentation, and he told me that his little sister struggled to get off the dummy for years, like back then. But weirdly enough, her teeth are straight now. So I asked him what dummy was she using, and he said she was using the Nook dummy. So even though she sucked it for way longer than she was supposed to and struggled to get off the dummy, because they used the properly designed one, it didn't affect her mouth that much, and her teeth are actually still straight without even having braces. So these dummies have all the characteristics that are ideal in terms of research. Number one, it has a small and flat teeth. Now this allows for even pressure on the palate, and it can easily fall out. Number two, it has a short and flat shaft, and this allows baby's mouth to actually stay closed while the dummy is still in their mouth. I'm not sure if you've ever seen toddlers or babies that suck those very round dummies. It actually ends up hanging in their mouth and their lips actually end up staying open. That's something we actually don't want to happen. Number three, it's lightweight, which allows for less pressure. And it can also easily fall out of their mouth. And lastly, it has a soft base. So it's basically compressible and it's flexible, and that mimics nature. If you've ever felt those, I'm not going to say which dummy, but the other round dummies, if you feel them, they're actually pretty hard and you can't even bend them very easily. So we want a dummy to be soft and flexible, ideally. The thing is, though, these brilliant people at Nook already know whatever I'm telling you guys now. And there's quite a bit of thought that has actually gone into designing their dummies. They understand the value of soothing for babies, but they're also aware of the potential negative effects it may have too. That is why 100% of orthodontists confirm that Nook's orthodontic soothers do not cause crooked teeth or jaw misalignment. 92% of breastfeeding mothers reported that the Nook dummies do not interfere with breastfeeding, and 95% of babies accepted the Nook pacifiers, indicating high acceptance rates amongst infants. So, the tongue. Let's just compare what the dummy shape does to the tongue. You can see with these flatter dummies, the tongue can still very easily rest up against the palate. But if you look at these big round dummies, it actually displaces your tongue and disrupts it. And in my opinion, there's nothing natural about that at all. So, the science behind Nook. It's a true orthodontic shape that's inspired by the natural nipple. It actually mimics the shape of the nipple while a baby is breastfeeding, which helps support natural oral development. It promotes the correct tongue posture. Its unique shape actually allows the tongue to go up and rest against the palate, which is crucial for proper swallowing, speech, and breathing, as we've just learned now. It supports healthy jaw and palate growth. The Nook shape allows for more natural movement of our tongue and our jaw, which reduces pressure on the soft tissues of our mouth when used appropriately. And number 4, it minimizes the risk of malocclusion, or basically bite problems. Compared to conventional soothers, the Nook's design has been shown to reduce the risk of bite issues when used appropriately. And lastly, it's backed by international studies and professional endorsements. Studies from Germany and beyond support its anatomical design, and it's often recommended by pediatric dentists and orthodontists all around the world. So, when I tell my patients that Nook's dummies are one of the only ones I do personally approve of, it's really not just marketing. It's literally scientifically proven. Thank you for joining me in looking deeper into something so simple, yet so significant. The smallest daily choices, like what dummy we're going to offer our baby, can shape their future in big ways. And you can ask me, because I, as a dentist, way back, gave my child orthodontic dummies, and whatever I spoke about now in terms of consequences, that's what my oldest child has. So major guilt trip, but that's why I'm here today. So don't be like me. Let's make these choices informed and intentional, because it's an investment in your child's breathing, sleeping, and development for years to come. Thank you.
Thank you so much.
Thank you.
That was very, very insightful. Obviously, I've had a sneak peek at the presentation, so it was nice to hear what she was actually going to say. I would like to, while I have you, I'd like to just go off script a bit and show you a picture and then get your sort of professional diagnosis.
Sure.
Okay. Maybe you want, yeah, you can sit there.
Okay, wow. So this is literally what we actually see coming through our door in older children. And we're just like, oh, because at this point, all you can do is corrective measures.
Yeah.
But if you'd seen this kid earlier, you actually could have intervened earlier in a much easier, cheaper, and natural way. But at this point, you actually have to have physical intervention
So
to
like
kind
braces.
of fix that bite. Yeah.
And what do you, and like how long would it take to fix an
So
overbite like that?
the thing with this is that it's not even just the teeth that are now affected, it's actually the jaw. Because usually if you have the situation, it could just be the teeth kind of like pushing forward. But if you look at that picture, your jaws are too far apart from each other. So as opposed to just doing braces, you're actually going to have like headgear or something similar to first bring your jaws almost closer together and then align the teeth thereafter. So at least 2 years of like intensive orthodontic treatment, at least. If you have maybe a good orthodontist and your jaw responds quickly, but the older you are, I would say at least 3 to 4 years.
Okay. That took 10.
Wow.
10 years.
Sure.
So those are actually horrifically, those are my teeth.
Yeah.
Yeah. So what happened? So, yeah, shame. When I was 10 months old, my dad, and I had a Nook dummy. I did have a Nook dummy because my dad is also Nook. He took my dummy away because he had seen all these other little boys, 3, 4, 5 years old, running around with dummies in their mouth. And he said, I don't like dummies. That, it's going to be a bit embarrassing. It's too old for my son to have a dummy. So let me try and get it out a little bit earlier. And he's at the Nook dummy. It should be fine. But let me just take it out. 10 months, he took it away. And for about 2 to 3 days, obviously non-stop crying. Difficult to soothe without your soother. And then all of a sudden I stopped crying. That's it. So then they looked and they said, okay, why has he stopped crying and what's he soothing on? I found my finger. And for the next 6 years, my parents tried absolutely everything to try and get me back onto the dummy. They tried to put nail polish on my finger. They tried to do all sorts of things. And I just wouldn't take it because I always had my finger with me. It was just wasn't even in the pocket. It was just there. And I was sucking on it in the middle of the night when they were sleeping, and there was absolutely nothing I could do about it. This picture, as you can see there, 2002, I'm not give my age away now, but I was 12 at that time. And I had seen at this point already maybe 2 orthodontists. So you need a good orthodontist, but I didn't start off very well. But I had braces all the way up until I was 19. And after which I then also had a nitrotainer. So I still required corrective measures after that until I was 22, 23. So I know the pain, and the thing is that, there's one thing, okay, you're going to have to spend money on an orthodontist and maybe medical aid will cover and blah, blah, blah. But that's nothing compared to the psychological pain and the low self-esteem that one experiences, especially going through high school with teeth like that. Because obviously, anyone who's had braces in this room knows and understands what it's like. So it can be, obviously eventually over time I got over it and I was able to move past it, but it really, really is a trauma. And obviously now something that fuels my passion for being with Nook and for using orthodontic dummies. So I just wanted to share that with you. There is this huge misconception that you're born with skew teeth and it's a genetic thing. It is completely avoidable, guys. It really, really, really is. And it's avoidable by encouraging soothing, giving the right shape, and then, as Dr. Farah mentioned, using it as a tool, not a crutch. Okay, so a soother is a tool to use, and who cares if your son or daughter is sucking on a dummy at 5 years old? This is this little graph here, and I can share this with you afterwards, but that little graph is a study comparing the amount of 5-year-olds that suck their finger versus the amount of 5-year-olds that suck a dummy. And there's far less 5-year-olds sucking a dummy than sucking a finger, let me tell you that. So you understand. You all would have...
Can I just say one thing?
Yeah.
When parents come in the door and they have this dummy, I have to actually activate poker face. I have to be like, would you mind if I share some information about dummies? I literally want to yank it and be like, this should literally be like gone off the face of the earth. Jeez.
Sure.
Yeah.
So it's, and one of the, and I didn't mention it in the beginning, but obviously with all this information and not being able to tell what is real and what is fake anymore, and we've all seen those AI videos now and you don't know what is real and what is fake. You guys as parents to be, you've got to be investigators. These are very important decisions, and I'd like to encourage you to be, when you see something that says orthodontic and it's got a little asterisk, and go, let me look on the packaging and look for the actual study that said that's orthodontic, because this is something I bought off Take A Lot, and it's one of those. This here you're going to actually be horrified because it says here orthodontic, but it's got a silicone teeth and an orthodontic shape. But then if you look at this, that is not an orthodontic shape. So this is straight out of China, and this is what is being sold in South Africa. And feel free to come and have a look at this. You'll see it's completely unregulated. And what it's doing is misleading a whole lot of people into making these decisions. I have a friend that I'm going to share a short video of, just someone I went to school with, and she has, well, let me play the video. And
my name is Sabrina, and when I had my son, I chose the most aesthetically pleasing dummy because I thought that if it was being sold in reputable stores, it obviously would have been studied. Very quickly, when I noticed other children using the same dummies that already had teeth, I noticed the same signature kind of bridge arch top teeth, which made me do my own research. And I very quickly realized that it was not safe to be using that teeth shape. And so I changed over straight away and got rid of all of my dummies and have become very passionate about sharing with other people that there is actually risk in that shape and that they are changing their child's jaw and teeth. And I can't really believe that it's allowed to be sold, but I'm very grateful for events like this that teach us more about these things so that we don't have to have the same consequence to our children.
You know, just someone I went to school with, and she's been commenting on some of the stuff that I've been posting on Instagram about using the right dummy. And when she shared the story with me, I was like, this is exactly case in point of what to try and avoid. And you can see, just look at that bridge on the top right there. It is really, really scary. And that requires a whole lot of, as Dr. Farah would say, a lot of corrective work later on. But yeah, let's do some.
Can I say one more thing quickly? On the point of genes affecting how your jaws grow, I actually want to bust that myth now. So only your lower jaw actually grows with genetic influence. Your upper jaw, it's fully your environment that you're in. So your upper jaw only grows based on what you actually put in your mouth and how you breathe. So just saying.
So the idea here is that we don't want to, this is not like, we don't want to scare you guys. Yeah. We want you to be informed. We want you to give you the information. We want you guys to see, because how do you know that this is going to be a problem when you only see this 5-10 years down the line. So it's up to people who see it and work in a day-to-day to communicate it, so that you are informed and you can make decisions with long-term benefits for your children.